If you're over 60, something happens in almost every medical appointment that no one ever explains to you. It's subtle, it's quiet, and most of the time, you don't even realize it's happening. But the moment you walk into a clinic or hospital, many doctors see your age before they see you as a person. Over the past few years, I've spoken with retired nurses, former physicians, caregivers, and older adults from all over the country. And again, I heard the same story in different words. Seniors often feel rushed, dismissed, talked down to, or treated like their concerns are simply part of getting older. Not because doctors are bad people. Most of them truly want to help. But because the system they work in has trained them to think in certain patterns. Patterns that quietly change how much time they give you, what questions they ask, what tests they order, and even how seriously they take your life. And the truth is, these patterns can cost you. They can delay real diagnoses. They can lead to the wrong medications. And in some cases, they can take years away from your life without anyone ever saying it out loud. Today, I want to share 5 uncomfortable truths about how age is treated in modern healthcare. Things most seniors are never told, but feel deep down in their gut. More importantly, I'll show you how older adults who understand these dynamics learn to take back control, how they speak differently, prepare differently, and walk into medical appointments with confidence instead of fear. Because you deserve care based on who you are, not how many birthdays you've had. The first ugly truth is this. Many doctors see older patients as expensive and complicated before the conversation even begins. Not out of cruelty. Not even consciously. It happens automatically. The moment your age appears on the chart, an internal calculation starts forming in their mind. More time, more conditions, more medications, more risk, more paperwork. In medical training, seniors are often categorized as high-maintenance patients. That label doesn't mean difficult personalities. It means patients who usually require longer appointments, more testing, and more follow-up care. And in a system that is obsessed with speed and efficiency, that perception quietly changes how you are treated. Let me tell you about Mary Thompson. Mary is 74 years old and spent most of her life working as a librarian in Ohio. She's organized, thoughtful, and very careful with her health. Before one appointment, she wrote down a list of symptoms she had been tracking for weeks. Chest discomfort, shortness of breath, fatigue that felt different from normal tiredness. She came prepared. But less than 2 minutes into the appointment, the doctor interrupted her. "Let's focus on one main concern today," he said. When Mary tried to explain that all her symptoms felt connected, the doctor sighed and replied, "We need to prioritize." Her chest pain was brushed aside and labeled as anxiety. She was told to relax more and reduce stress. 6 months later, after collapsing at home, she was diagnosed with a serious heart condition that could have been detected much earlier. This is what complexity avoidance looks like in real life. Doctors are under enormous pressure. Insurance companies pay less. Patient quotas keep rising. Appointments are shorter than ever. So when a senior walks in with multiple concerns, the subconscious reaction is often to simplify, minimize, and move on. Not because your problems aren't real, but because dealing with them properly takes time they feel they don't have. The deeper issue is psychological. When healthcare providers see you as complicated, they stop thinking collaboratively. Instead of exploring your situation fully, they fall back on standard senior protocols, generic advice, surface-level treatments, and assumptions based on age, not individual reality. So how do you shift this dynamic? Start every appointment with a clear, measurable goal. Instead of saying, "I feel tired," say something like, "My energy has dropped by about 40% over the past 3 months, and I want to understand why." That single change reframes you in their mind. You are no longer a vague, complicated patient. You become a focused person seeking specific answers. Second, bring a 1-page health summary. Not your entire medical history. Just the key points. Your main conditions, current medications, recent changes, and what you are trying to improve. This shows you are organized and engaged. Third, don't be afraid to request proper time. You can say, "I know today is limited. Can we schedule another appointment to go deeper into my cardiovascular concerns?" This respects their schedule while protecting your health. And finally, take notes during the visit. When doctors see you writing things down, they instinctively slow down, explain more carefully, and take you more seriously. It's a small shift, but it moves you from being seen as a burden to being seen as a partner. The second uncomfortable truth is this. Many doctors politely dismiss serious symptoms in older adults by calling them normal aging. It usually sounds harmless. Phrases like, "At your age, that's expected," or "We all slow down eventually," are said with a calm voice and a gentle smile. But behind those words is a dangerous assumption that aging itself is the cause, instead of something that deserves real investigation. Let me tell you about Carl Reynolds. Carl is 67 and spent most of his life working as a construction supervisor in Arizona. He was strong, active, and rarely visited doctors. But over the course of 8 months, he began feeling unusually exhausted. His joints felt stiff every morning. Simple tasks left him drained. Each time he visited his family doctor, the answer was the same. "Carl, you're not 30 anymore. Your body is slowing down." So Carl accepted it. He pushed through the pain. He stopped hiking. He napped more. He told himself this was just what getting older felt like. Finally, after his wife insisted, he demanded proper blood work. The results showed severe inflammatory arthritis. By then, permanent joint damage had already occurred. Damage that could have been reduced or prevented if the symptoms had been taken seriously earlier. This kind of medical gaslighting follows predictable patterns. Doctors redirect conversations away from testing and toward lifestyle advice. Exercise more. Sleep better. Reduce stress. All good suggestions, but not explanations. The problem isn't that aging changes the body. Of course it does. The problem is using age as a shortcut for not looking deeper. When serious symptoms are labeled as normal, seniors begin to doubt their own experiences. They stop trusting their instincts. They delay seeking help. And over time, they internalize the belief that discomfort is something they are simply supposed to live with. This psychological effect is one of the most damaging parts of medical ageism. So how do you protect yourself from this? First, create a symptom timeline. Instead of saying, "I feel more tired lately," say, "My energy was stable until March 15th. Since then, I've needed afternoon naps every day." Specific dates change the conversation. They turn vague complaints into measurable changes. Second, ask for evidence. When a doctor says something is normal for your age, you can calmly ask, "What percentage of people my age experience this exact symptom?" Most of the time, there is no real data behind the statement. Third, use comparison questions. Ask, "What tests would you order if I were 40 with these same symptoms?" This forces the doctor to confront whether age alone is driving their decision. And finally, bring an advocate, a spouse, a child, or even a close friend. When another person is present, doctors explain more, listen longer, and are less likely to dismiss concerns. You don't need to argue. You don't need to be aggressive. You just need to stop accepting age as an explanation for pain. The third ugly truth is one of the most painful. Many doctors quietly assume that older patients are mentally declining, even when there is no evidence. This assumption shapes everything: how they speak to you, how much they explain, what treatment options they offer, and how seriously they believe you can participate in your own care. It often shows up in subtle ways. Doctors speak slower. They use simpler language. They avoid technical details. They skip explanations they would normally give to younger patients. not because you asked for it, but because they assume you won't understand. Let me tell you about Louise Carter. Louise is 71 years old and spent over 30 years as a chemistry professor in California. She is sharp, curious, and deeply involved in her own health decisions. When she was diagnosed with early-stage breast cancer, her oncologist immediately recommended a very simple surgical option. No discussion about targeted therapies, no mention of reconstruction, no information about clinical trials or alternative approaches. He simply said, "At your age, we want to keep things straightforward." Louise later discovered that women 20 years younger with the same diagnosis were routinely offered multiple treatment paths. She had to fight for months to receive the same information and choices. This is cognitive prejudice. Doctors often underestimate the mental abilities of seniors and adjust care accordingly. They choose simpler treatments, not because they are better, but because they believe older patients can't manage complexity. The danger is not just emotional, it's medical. When doctors believe you can't handle complex information, they don't offer advanced therapies. They don't explain risks properly. They don't involve you fully in decision-making. You receive less effective care simply because of assumptions about your mind. Over time, this becomes a self-fulfilling cycle. Seniors start to internalize these expectations. They ask fewer questions. They rely more on authority. They begin to believe they are less capable, even when they are not. So how do you break this pattern? Start every important medical conversation by clearly stating your background. You can say something like, "I spent most of my career managing complex projects, so I'd appreciate detailed explanations of my options." This immediately reframes how you are seen. Second, ask for full explanations. Don't accept simplified summaries. You can calmly say, "Can you walk me through how this treatment works and what the alternatives are?" Third, bring your own research. Articles you've read, questions you've prepared, notes from other specialists. This signals that you are engaged and intellectually capable. Fourth, use technology during the appointment. Open your health app. Refer to your online records. Look up medication interactions. These small actions challenge outdated stereotypes about seniors and technology. And finally, request written treatment plans. Say, "I'd like detailed documentation so I can review everything at home and make informed decisions." You are not too old to understand your body, and you are not too old to deserve the full truth about your health. The fourth ugly truth is one of the most disturbing. Medications are often prescribed to older adults not to truly heal them, but to make them easier to manage. This happens quietly in hospitals, clinics, and care facilities every day. Seniors who ask too many questions are labeled as anxious. Seniors who express frustration are labeled as difficult. Seniors who show strong emotions are labeled as unstable. And instead of addressing the underlying cause, they are given pills. Let me tell you about Beverly Anderson. Beverly is 69 years old and spent her life working as a school principal in Michigan. After hip surgery, she became frustrated with the slow pace of her recovery. She asked detailed questions about her treatment plan and wanted clear timelines. The medical staff began describing her as agitated. Soon after, she was prescribed an anxiety medication to help her relax. Within days, Beverly became confused. Her balance worsened. One evening she fell while walking to the bathroom and broke her wrist. What should have been a simple recovery turned into 4 extra months of rehabilitation. The medication didn't solve a medical problem. It created new ones. This is sometimes called chemical restraint, using drugs to manage behavior instead of improving health. Studies show that a large percentage of seniors are prescribed psychiatric or mood-related medications without having a clear mental health diagnosis. These drugs can cause dizziness, memory problems, emotional numbness, and increased risk of falls. Even more concerning, these medications often create the very symptoms they claim to treat. Sedatives can cause confusion that looks like dementia. Mood stabilizers can cause apathy that looks like depression. Sleep aids can disrupt natural sleep cycles and create long-term sleep issues. And once a senior starts taking these medications, it becomes very difficult to stop. New side effects appear, more drugs are added, and the original problem is never truly addressed. So how do you protect yourself? Before accepting any new medication, always ask a simple question. What specific condition does this medication treat? If the answer is vague, like anxiety or agitation, ask for clearer diagnostic reasons. Second, ask for measurable goals. You can say, what changes should I expect to see, and how will we know if this medication is working? Third, request regular medication reviews. Independent pharmacists or specialists can identify unnecessary drugs, harmful interactions, and opportunities to reduce your medication load. Fourth, document your baseline. Before starting any new psychiatric medication, take note of your memory, balance, mood, and energy. This helps you recognize drug-related changes early. And finally, choose a trusted person who can advocate for you. Someone who will speak up if your personality changes or your clarity declines. Medications should support your life, not silence your voice. The fifth ugly truth is the hardest to accept. Behind closed doors, many healthcare systems quietly calculate how valuable your life is based on your age. Not in emotional terms, in economic terms. Medical decisions are often influenced by formulas that estimate how many useful years a person has left. The older you are, the less worthwhile certain treatments are considered. Not because they wouldn't help you, but because the system has decided your remaining time is worth less investment. Let me tell you about Walter Brooks. Walter is 68 years old and worked most of his life as an engineer in Colorado. He was active, independent, and mentally sharp when he was diagnosed with kidney failure. Instead of being offered aggressive treatment, Walter was gently guided toward comfort care. One doctor even told him, "At your age, dialysis may not be the best option." Walter didn't accept that answer. He researched. He sought a second opinion. He demanded proper evaluation. 3 months later, he finally started dialysis. The result? He returned to hiking, volunteered at a local community center, and lived 7 more full, active years. Years he would have lost if he had accepted the original recommendation. This kind of age-based calculation affects more than major procedures. Seniors are often denied advanced imaging, preventive screenings, and specialized therapies because insurance companies assume they won't live long enough to benefit. Mental health care is even more neglected. Depression and anxiety in older adults are often dismissed as natural reactions to aging instead of treated seriously. Therapy is considered unnecessary. Support is minimized. And emotional suffering is quietly accepted as normal. Over time, something even more dangerous happens. Seniors begin to internalize these judgments. They start believing their lives are less worth saving. They stop advocating for themselves. They accept limited care. And they make decisions based on what society expects, not what they truly want. So how do you fight this? First, always ask this question. Would you recommend the same treatment if I were 40? If the answer is no, ask for medical reasons, not financial ones. Second, research outcomes for people your age. Many seniors respond extremely well to treatments that are often withheld. Bring that evidence into your appointments. Third, seek second and even third opinions, especially from specialists who focus on older adults and understand real senior outcomes. Fourth, connect with senior advocacy organizations. These groups help challenge insurance denials and guide patients through appeals. And finally, know your rights. Age discrimination in healthcare is illegal in many situations. You are entitled to equal access, equal evaluation, and equal respect. Your life is not a number, and it is not less valuable because of your age. Mary, Carl, Louise, Beverly Walter. They are not rare cases. They are simply older adults who refuse to stay silent. Each of them was initially treated through the same lens. Too old, too complicated, too emotional, too slow. too expensive, and each of them paid a price for those assumptions. But something changed when they stopped accepting age as an explanation. Mary began preparing for every appointment and demanding proper time. Carl stopped trusting vague reassurances and asked for real tests. Louise insisted on being fully informed and involved in her treatment. Beverly questioned medications and reclaimed her recovery. Walter fought for the right to live fully instead of fading quietly. None of them had special power. They simply chose not to disappear inside the system. And that is the real lesson here. Medical ageism only works when seniors become passive, when they doubt themselves, when they stay polite while being overlooked, when they accept less because they think that is what aging means. But aging does not mean shrinking. It does not mean becoming invisible. And it certainly does not mean surrendering your voice. Every time you ask better questions, you change the dynamic. Every time you prepare instead of apologize, you gain control. Every time you speak up, you make the system adjust, not just for you, but for the next older person who walks into that same office. If this message resonated with you, tap the like button so more seniors can see it. Subscribe to Senior Living Advice for honest conversations about aging with dignity. And in the comments, share your experience. Have you ever felt dismissed by a doctor? Your story might help someone else feel brave enough to speak.